What if your lifetime of savings could vanish with one wrong check mark on a form? That was a question I never thought I'd have to ask. For 4 decades, my husband and I did everything right. I was a teacher, we raised a family, and we diligently saved, watching our 401k grow. We had a simple, beautiful plan for our life together, anchored by the creak of our old porch swing. We'd travel, spoil our grandkids, and finally enjoy the peace we'd worked so hard for. That feeling of security, the one I spent a lifetime building, evaporated in that pharmacy. It was shattered by a single diagnosis, a single prescription, and a single devastating mistake. I had chosen the wrong Medicare plan. That one decision, a choice I made in minutes to save a little on a monthly premium, ended up threatening the very nest egg I had so carefully nurtured. 40 years of work, poised to be undone in a few weeks. I'm sharing my story not for sympathy, but as a warning, so you can learn from my financial disaster. But that shocking pharmacy bill wasn't the beginning of the nightmare. First, I had to face the fact that my trusted doctor was now completely out of reach. It all started with what I thought was a savvy financial move. The Medicare commercials, once so reassuring, now felt like a cruel mockery. The smiling seniors, promising $0 premiums, bundling everything, dental, vision, prescriptions, into one neat package. Compared to the confusing multi-part path of original Medicare, it felt like a no-brainer. I saw a plan from a big, reputable company with a name I trusted. It had a $0 monthly premium. $0. For a retiree on a fixed income, it sounded like a secret code I'd cracked. I was healthy, I rarely saw a doctor, and I told my husband, why pay hundreds a month when we can pay nothing? I remember feeling so smug, so proud of the money I was saving for our travel fund. My husband, always cautious, asked if I'd read the fine print. I waved him off. "It's a major company," I said. "How bad can it be?" That sentence would come back to haunt me. For the first year, everything was fine, confirming my bias. And then came the fatigue. It was a deep weariness I couldn't shake. I blamed it on age, but then came the dizzy spells. One afternoon, while tending the roses my husband and I had planted the year we retired, their scent always reminded me of our future. The world tilted, and I had to grab the fence to keep from falling. That's when the fear set in. I called Dr. Miller, my primary care doctor for 15 years. He ran some tests. A week later, he sat me down and gave me the news. I had a rare, chronic blood disorder. He assured me it wasn't a death sentence, but it was serious and would need immediate, specialized treatment. He referred me to a hematologist, the best in the city, he said, and wrote 2 prescriptions. I left his office in a daze, clutching those slips of paper, scared but grateful. Grateful for a diagnosis, for a plan, and for having good insurance to cover it all. That sense of security was the first thing to crumble. The specialist was a roadblock, but the pharmacy counter held a financial avalanche I never saw coming. My first call was to the hematologist's office, the specialist doctor. Miller called the best. I gave the receptionist my insurance information, the card from my $0 premium Medicare Advantage plan. There was a pause, a long, ominous silence. Then she came back on the line. "Ma'am," she said gently, "I'm very sorry, but doctor, Adams is not in your plan's network. I didn't understand. But it's a PPO plan. I thought I could go anywhere. You can, she explained, but seeing an out-of-network provider means you'll be responsible for a much higher percentage of the cost. You'd have to pay the full cost of the visit up front and try to get reimbursed. There's no guarantee they'll pay. She quoted me the price for an initial consultation, over $1,000, just to walk in the door. Panic rose in my throat, hot and sharp. I called my insurance company, navigating an infuriating phone tree only to get a scripted agent on the line. Yes, that specialist is out of network, he said, his voice a flat, robotic drone. That is the policy, ma'am. His rehearsed sympathy felt like a slap in the face. He offered a list of in-network doctors I didn't recognize. These weren't the experts my own trusted doctor wanted for me. They were just names on a list who agreed to the insurance company's rates. I felt like I'd been tricked. The smiling people in the commercials never mentioned this. They smiled and took my enrollment, but now that I was sick, they had turned their back. This was my first devastating lesson. I'd chosen my plan based on the premium, not the network. I had traded access to the best care for that seductive $0 price tag. I paid the specialist's bill, feeling the loss of that European cruise in my bones. But that was just the first tremor. The real earthquake was waiting for me at the pharmacy. Still reeling, I went to fill the 2 prescriptions from Dr. Miller. I handed the pharmacist the slips of paper and waited. He took them. He typed. He paused. A long pause. Then he slowly looked up at me with that look of pity. Mrs. Gable, he said. The first medication. It's not on your plan's formulary. They won't cover it. The cash price is $1,800. I just stared, speechless. Not on the formulary? Another term I'd ignored from the fine print of the plan I was so proud of. The memory of Christmas morning flashed in my mind. I could still see my kids' relieved faces as I boasted about my fantastic new insurance. Don't you worry about me, I'd said, so proud. Mom is finally secure. The shame of that memory burned my cheeks. What about the second one? I whispered. That one is on their specialty tier, he said. Your copay is $950 for a 1-month supply. I leaned on the counter, lightheaded. Then the pharmacist said something that changed everything. Now hold on, he said, looking at his screen. There's a new law that started this year. The Inflation Reduction Act puts a cap on out-of-pocket drug costs. The most you will have to pay for all your covered prescriptions for the entire year is $2,000. For a second, I felt a wave of relief. It was quickly followed by a harsh reality. So, what do I owe today? I asked. He did the math. Well, you'll hit your $2,000 cap with this very first fill. After you pay that, you'll owe nothing for your covered drugs for the rest of the year. But you have to come up with that $2,000 right now. $2,000. A massive, unexpected blow to our fixed income. The $0 premium was a cruel joke. It was a lure that hid the real costs. The true price of my health care wasn't $0. It was thousands for doctors, plus a shocking $2,000 drug bill right out of the gate, all of it draining the nest egg we'd spent 40 years building. That night, I would realize the trap was even bigger than I could have imagined. And there was a final, more devastating twist I wouldn't uncover until much later. If my story is making you question your own plan, take a moment to subscribe. I'm going to share exactly what I learned to expose these traps so you can arm yourself with the knowledge to protect your health and your retirement. Don't let what happened to me happen to you. The days that followed were a fog of fear and paperwork. I tried appealing the decision for the non-covered drug. It was a soul-crushing process of phone calls and forms that went nowhere. The insurance company demanded I try cheaper, older drugs first, a process called step therapy. They weren't my doctor. They were a business managing costs. I felt trapped. I felt stupid. I felt alone. That night, I sat at our kitchen table, the smooth oak cool beneath my trembling hands. This was the same table where we'd celebrated decades of birthdays, where the rich smell of Sunday roast once filled the house with warmth and joy. Now, the only smell was the sterile paper of the bills piled in front of me. My eyes fell on the old wooden box on the mantel, the one filled with my teaching mementos, 35 years of school photos and thank you notes from students. A lifetime of careful work, all being threatened. My husband found me there, shoulders slumped. He didn't say, "I told you so." He simply went to the stove, put the kettle on, and came back with a warm mug of tea. He placed it in my hands, his fingers gently wrapping around mine, and I saw his own fear reflected in his eyes, the worry etching new lines on his face. My deepest fear surfaced, the same one my own mother used to whisper, "I just don't want to be a burden." After all our years of partnership, I was becoming a problem for him to solve. It was then I finally did the research I should have done a year earlier. I realized Medicare is a fork in the road. There are two main paths. Path 1 is Original Medicare. That's the government program, Part A for hospital and Part B for medical costs. Almost any doctor in the country who takes Medicare accepts it. No restrictive networks. The catch is, it only covers about 80% of your Part B bills, and there is no annual cap T on that 20%. To cover that whole, you buy a Medicare supplement plan, or Medigap. You also buy a separate Part D plan for prescriptions. This path usually has higher monthly premiums, but for those premiums, you get freedom of choice and protection from catastrophic costs. Path 2 is the one I chose, Medicare Advantage or Part C. Private companies offer these plans, bundling your benefits. The lure is that low or $0 premium. But I had confused the premium with the total potential cost. These plans use restrictive networks and cost sharing to manage their expenses. And while they have an annual out-of-pocket maximum, that max can be very high, up to $9,350 for in-network services in 2025. That number doesn't even include your drug costs, which now have their own separate $2,000 cap. I had chosen a low-premium, high-risk plan. I was betting on staying healthy. The moment I got sick, the bet was lost. This is the critical lesson. A low premium does not mean low cost. I was trapped in my plan for the rest of the year. I had to wait for the annual enrollment period from October 15th to December 7th to make a change. Those agonizing months felt like a countdown to disaster. My 401k drained faster than I could have imagined. Another $3,000 withdrawal 1 month for an out-of-network appointment. That was the contribution to our grandchild's college fund, Gone. Another petal fallen from the roses of our future. $2,500 the next. That was the kitchen renovation we'd talked about for years. Each withdrawal felt like another piece of our future. A trip not taken, a memory not made, gone forever. When enrollment finally opened, I was ready. I ignored the commercials. I forced myself onto Medicare.gov, my screen filled with a nightmare of spreadsheets, plan codes, formularies, tiers, deductibles, SNPS, PPOS, HMOS. It was an alphabet soup of jargon designed to confuse, and I was drowning in it, terrified of clicking the wrong box and starting this disaster all over again. I thought of my friend Martha, who'd gotten stuck in an HMO and couldn't see her oncologist for 3 critical months after a breast cancer diagnosis. I was determined not to let that happen to me. I switched back to original Medicare, bought a comprehensive Medigap plan, and enrolled in a standalone Part D drug plan I had meticulously researched. My monthly premiums are higher now, much higher than zero, but my costs are predictable. I can see the doctor I choose. The financial bleeding has stopped. I have peace of mind, but it came at a steep price. The portion of my 401k I was forced to spend is a permanent scar on my retirement. Here is your checklist to prevent this. First, make 2 lists. Every doctor and hospital you would ever want to use, and every single prescription you take. These are your most important tools. Second, understand the 2 paths. One is about freedom and predictable costs for a higher premium. The other is a low premium gamble with network restrictions and high potential out-of-pocket costs. Choose the path that fits your tolerance for financial risk. Third, use the official resources. The Medicare.gov Plan Finder tool lets you enter your drugs and pharmacies to estimate annual costs for every plan in your area. This helps you see beyond the premium. Fourth, verify everything. Call your doctor's offices. Ask the billing manager, do you participate in this specific plan? For your drugs, look up the plan's official formulary or call to confirm coverage. This is the most critical step. Finally, you must do this every single year. Networks and costs change. The annual enrollment period from October 15th to December 7th is your chance to avoid my fate. Don't just let your plan auto-renew. Choosing a Medicare plan is one of the most critical financial decisions of your retirement. The system is complex, and the commercials make it look easy. But the wrong choice can unravel 40 years of careful planning. My story had a difficult, but ultimately manageable outcome. I lost a chunk of our savings, but I corrected my course. For some, like my friend Martha, the consequences are even more dire. But here is the final, most devastating twist I learned in all of this. You are not meant to do this alone. The big insurance companies have armies of agents working for them. You need someone in your corner. Find a reputable, independent insurance agent who specializes in Medicare. An independent agent doesn't work for just one company. They can help you compare plans from multiple carriers to find the one that truly fits your needs, not their sales quota. It's the one thing I wish I had done from the very beginning. Don't repeat my mistake of thinking you can figure this out from a TV ad. Building your retirement takes a lifetime. Don't let a decision you make in a few minutes jeopardize it. Now, when I sit on our porch swing, the familiar creak is both a comfort and a reminder. I feel the bitter-sweet relief of a battle finally won, and the haunting sorrow for what was lost. Protect your health. Protect your savings and protect your future. Watch this next for another gripping tale of retirement gone wrong, plus the lesson you can't afford to miss.